Why pediatric immunizations matter. Pediatric vaccines help children build protection against serious infections and diseases before they are exposed to them in everyday life. Instead of facing the full strength of diseases like measles or pertussis, the immune system is safely trained through vaccination, reducing the risk of hospitalizations and complications such as severe illness, disability, and death. Immunizations also support healthy families and communities by reducing missed school days, caregiver work absences, and emergency visits. When children are vaccinated according to recommended schedules, communities experience fewer outbreaks and more stable use of healthcare resources. Immunity: how the immune system works. The immune system is basically the body's defense system. It constantly scans the body for germs, viruses, and bacteria that do not belong. When it comes across one, it responds by fighting it off and creates memory cells that remember how to respond to that same one if it appears again. Vaccines help this natural system by giving it a safe preview of the germ, virus, or bacteria without causing the full-blown illness or disease. This training allows a child's immune system to react more quickly and effectively in the future, often preventing illness or making it much milder or not as bad if exposure does occur. Herd immunity, community protection. Herd immunity happens when enough people in a community are vaccinated and immune to a disease that the germ has a hard time finding new people to infect. In this situation, germs have fewer opportunities to spread, which helps prevent large outbreaks, especially in crowded settings like schools and childcare centers. This kind of community protection is especially important for people who cannot safely receive certain vaccines, such as some infants or children with serious medical conditions. When families participate in vaccination, they not only protect their own child, but also contribute to a safer environment for classmates, neighbors, and vulnerable community members. Types of immunity and vaccination. There are a few different ways the body can become immune to a disease. Natural immunity develops after someone has actually been infected and recovered, but that often means going through a serious illness first. Vaccine, or artificial, immunity gives the immune system a safe practice run so it can recognize the germ later without the child having to experience the full disease. Active immunity happens when the body makes its own antibodies, like it does after vaccination, and this protection usually lasts longer. Passive immunity is temporary protection that comes from another source, such as antibodies passed from mother to baby during pregnancy, and it fades over time. Routine pediatric vaccines focus on building strong active immunity that can be boosted as children grow. Effects of immunization on the individual child. For each child, vaccines lower the chance of getting sick from diseases such as measles, meningitis, and pertussis. These infections can cause long-term problems like brain injury, hearing loss, or lung damage, so preventing them is a major part of keeping kids healthy as they grow. Staying up to date on immunizations also means fewer emergency visits and hospital stays for preventable illnesses, which can lower family stress and financial burden. When children are protected, they are more likely to attend school regularly, participate in sports and activities, and keep up with their normal routines at home and in the community. Effects of immunization on communities and worldwide. When many children in a community are vaccinated, there are fewer outbreaks of vaccine-preventable diseases in schools, childcare centers, and neighborhoods. This helps keep classrooms open, routines more stable, and vulnerable people better protected from serious infections. Immunization also reduces strain on healthcare systems by preventing illnesses that would otherwise require clinic visits, emergency care, or hospitalization. Preventive services, including vaccines, are consistently shown to be high-value, cost-effective ways to improve population health, both locally and globally. Around the world, coordinated vaccine programs have contributed to major declines in diseases such as measles and polio. Pediatric vaccination trends. Across the country, many children receive their vaccines on time as part of routine well-child visits. Pediatric guidelines such as Bright Futures build immunization into regular health supervision, which helps families and providers stay on track with their recommended schedule. At the same time, not all communities have the same level of vaccine coverage. Barriers such as access to care, transportation, time off work, or conflicting information can lead to missed or delayed doses. When vaccines are postponed, children have longer periods without full protection, and communities face a higher risk of outbreaks of vaccine-preventable diseases. Disease trends and conditions prevented by vaccines. CDC estimates that vaccines will prevent hundreds of millions of illnesses and millions of hospitalizations. Vaccines have significantly reduced the rates of diseases such as measles, pertussis, and certain types of bacterial meningitis. As a result, many families will never witness the severe outcomes these infections can cause, such as neurological damage, chronic respiratory problems, or long-term disability. A strong immunity keeps our children healthier and reduces costs in medical care. When vaccination coverage falls, these diseases can return quickly and spread in schools and communities, demonstrating that these illnesses still exist and can cause serious harm. Vaccine safety is ensured. Before vaccines are added to the routine schedule and recommended for children, they go through multiple phases of clinical trials that assess safety, effectiveness, and appropriate dosing. Only vaccines that meet strict safety standards are approved. After approval, vaccine safety continues to be monitored through national surveillance systems and ongoing data review. Organizations such as the Centers for Disease Control and Prevention help healthcare providers stay informed about potential side effects and best practices for counseling families. Vaccine safety is also monitored after vaccines are in use. National reporting systems allow healthcare providers and families to report possible side effects, and experts regularly review this information to look for patterns or rare reactions. This ongoing monitoring helps keep the recommendations current and gives families an added layer of protection and reassurance. Vaccine safety concerns, myths versus facts. Families often have reasonable questions about vaccine safety. One common worry is that getting several vaccines at the same visit might overwhelm a child's immune system. Some parents also worry about serious or long-term side effects. Other concerns focus on ingredients. And others have the idea that natural infection is better. Research shows that children handle far more immune challenges from everyday life than they receive in vaccines, and the schedule is designed to protect them at the safest and most effective times. These reactions are very rare and are monitored closely through national safety systems. Most side effects are mild and short-lived, such as soreness, fussiness, or a low-grade fever. Vaccine ingredients, including small amounts of preservatives or aluminum, are carefully studied and used at levels that are considered safe for children. While natural infection can lead to immunity, it also carries real risks of hospitalization, long-term disability, or death. Vaccines offer a safer way to build protection without putting children through the full severity of these diseases. Immunization schedule, infants and young children. The recommended vaccine schedule begins at birth and continues regularly through the first several years of life. During this time, infants and young children receive vaccines that protect against serious illnesses such as hepatitis B, diphtheria, tetanus, pertussis, polio, Haemophilus influenza type B, HIB, pneumococcal disease, measles, mumps, and rubella. The timing and spacing of these vaccines are based on when children are most at risk and when their immune systems can respond best. These vaccines are usually given at well-child visits, which also include growth checks, developmental screening, and anticipatory guidance for families. Pediatric guidelines like Bright Futures integrate immunizations into routine health checkups so that vaccines are not an extra step. Following the recommended schedule helps ensure that children are protected as early and as safely as possible. Immunization schedule: older children and teens. As children move into the preteen and teen years, they need additional vaccines to keep their protection up to date. Around ages 11 to 12, this usually includes a Tdap booster to protect against tetanus, diphtheria, and pertussis, the HPV vaccine to reduce the risk of HPV-related cancers, and a meningococcal vaccine to prevent serious infections of the brain and bloodstream. Annual flu shots are also recommended for most children and teens to reduce the spread of influenza in families, schools, and communities. The adolescent years are also an important time to catch up on any doses that were missed earlier in childhood. Pediatric guidelines such as Bright Futures encourage using sports physicals, school checkups, and routine visits as opportunities to review vaccine records and offer needed boosters or catch-up immunizations. Staying current with these vaccines helps prepare teens for school, sports, work, and future college or training programs where immunization requirements are common. Legal and policy issues in pediatric vaccination. In the United States, many states require certain vaccines before children can attend school or daycare. These laws are designed to reduce outbreaks in group settings where infections can spread quickly among children. Most policies include medical exemptions for children who cannot safely receive specific vaccines due to documented health conditions, but the exact requirements and exemption rules vary from state to state. From a professional standpoint, nurses are guided by ethical codes that support public health and disease prevention. The American Nurses Association emphasizes the nurse's responsibility to promote health, prevent illness, and protect vulnerable populations, which includes supporting evidence-based immunization policies while still respecting legal frameworks and individual rights. Understanding these laws and policies helps nurses answer questions, advocate for families, and navigate situations where school or daycare requirements intersect with health and safety concerns. Ethical, cultural, and compassionate care. Ethical vaccine conversations and considerations are built on respect for family values, cultural background, and the child's best interest. Principles such as autonomy, beneficence, non-maleficence, and justice help guide these discussions, along with the nurse's professional responsibility to promote health and prevent harm. Instead of pressuring families, we can ask open-ended questions, listen carefully to concerns, and provide clear, honest information about both the benefits and risks of vaccines. Shared decision-making invites parents to be partners in the process. The provider offers evidence and recommendations, and the family shares their goals, questions, and preferences so decisions are made together. Cultural and literacy-sensitive communication, such as using plain language, checking understanding, easy-to-read handouts, and being mindful of past experiences with healthcare, build trust especially in communities that have faced disparities and misinformation. This approach helps families feel heard and supported while still promoting safe, evidence-based pediatric immunizations. And finally, asking if they have any other questions. My goal is not just to give families information, but to walk alongside them as they make the best decisions for their children and families. Their questions are an important part of keeping our whole community healthy.